Paramedic Services Committee. Today it'll be budget. And I'll note that attendance has been taken. We've not regrets from anyone, but we're hoping Councillor Hunt will join us on Zoom. She usually does. Before we get into the approval of the agenda and the rest of the committee, I'm just going to read out the Riot Act to everybody. Please note that I don't want any acrimonious accusations of any other committee members' intentions or thoughts on what we're talking about today. I wasn't pleased with the way the tone went last week. From where I sit, I think every committee member here is working very, very hard for the best interests of the ratepayer of our communities and for the paramedic service. I think we may have disagreements about how we get there, but like I say, at the end of the day, we're all out to do our best for the people we represent. So if I hear any, like I say, acrimonious accusations about what other members are thinking or their intentions, I will call you out on it, and hopefully that stops it. Hopefully we don't get to that point. So on that note, we'll go to item 2, and that's the approval of the agenda. Can I get a mover for that, please? Moved by Mayor Bailey, second by Councillor Martin. Does anyone have anything they wish to add? Okay, seeing none, I'll call the vote. All in favor of the agenda? So moved. So passed. We're going to skip on to item 4, staff reports. What we're going to do? Well, no, we'll do that at the appropriate time. We're going to go to staff reports, item 4.1. So before we get to that, Cindy did do a short presentation, and what this is about is what were the numbers for the budget looking like if we didn't go with 9 ambulances? What if we went with 8.5 as we had in 2024? What if we went to 8? So before we, we'll have Cindy present on that one. Actually, let's get a mover to get just this on the floor because this will be for information. Okay, moved by Councillor Pierce, second by Mayor Davis. So Cindy, go ahead with your presentation. And then if you have any questions, we'll ask them at the end.
Good morning. So as Chair Miller said, I have summarized the report on the budget update for committee this morning, and following that, staff will be happy to answer any questions. At the last meeting, committee asked staff to come back with 3 options. Option 1 is to maintain the proposed level of approved resources.
Hold on one second, Cindy. Is the public?
Oh, there we go. Sorry about that. There we go.
Okay.
Thank you.
All right.
Okay. Option 2 is proposed budget reduces level of resources in 2026 to 8 ambulances. And option 3 is to reduce the resources to 8.5. So the report speaks to a look at the demand for service in Brantford. The Ambulance Strategic Action Plan that was adopted in 2016 concluded that the service faces significant demand challenges driven by population growth, the aging population, and increasing propensity to call an ambulance. The increasing propensity to call an ambulance is driven by the aging population, as senior citizens have a higher likelihood of requesting an ambulance. The action plan projected a 6% average annual call volume growth over the next decade, which is what has transpired. At the time of the plan, the offload delays experienced locally were low in comparison to other urban centers in the province. This changed dramatically over the last 5 years and resulted in eroding our system capacity. The service has been operating over capacity over the last 5 years, even with the injection of additional resources year over year. So, over the past few years, the service has been looking at system capacity strategies to address the demand for service. The first is the offload delay project, and the stats that we ran show that the service would be operating at over 100 capacity this year, even with the additional resources approved in 2025, probably in the 111% range in 2026, if we had not had the successes in that project over the last year. Reducing offload delays has reduced the number of code zeros and ambulances responding to calls from outside Brantford. Patient risk increases significantly when zero ambulance units are available, particularly for urgent calls. The gains made in offload delays are a success, but noted with some caution, as efficiencies in the hospital system will peak without additional capacity and could be impacted if the hospital experiences volatility in staffing or leadership. The community paramedicine program is another strategy to help reduce unnecessary ER visits by bringing primary care into a patient's home or community setting. It's difficult to quantify the numbers specifically, but it's estimated that between 1,000 and 1,800 calls will be diverted from the ER through the CP program this year. For 911 calls for service, as we discussed at the last meeting, the service cannot refuse, nor can Central Ambulance Communications Center a call for service. The service did participate in a provincial campaign this year to battle against 911 misuse through the 911 call volume reduction working group. In addition, the service developed a local resource to educate residents on appropriate circumstances to call 911 and medical resources available in the community. Alternate destination models. Staff investigated this and reported to committee in 2023. At that time, there were no other destinations in the area willing or able to accept patients. The service continues to explore opportunities in this area, particularly through the CP program. And the dispatch system. Our system capacity will be better prioritized through the impending launch of Medical Priority Dispatch System in November of this year, which the service has been advocating for years. The MPDS system will give the most urgent calls top priority, with non-urgent calls waiting longer for response. Staff have done some research on other innovative strategies and ideas implemented globally to reduce call demand on paramedic services. These include data-driven demand management, which uses analytics to identify patterns and intervene early. Addressing the social determinants of health is also important, but mainly provincially driven to stem calls from unmet social needs, including housing, transportation, mental health, and addiction support. Brantford is experiencing a surge in homelessness, which can impact our calls for service as well. The service does not operate in isolation and is part of a continuum of health and social services within the province. The experience and demands on the service is closely impacted by factors beyond the direct control of the service. Investments by the province in key priorities such as primary care, availability, and social services programs would help prevent the reliance placed on emergency services. So this chart looks at call volume capacity estimates based on the 3 options requested by committee. The metric for 2025 and 2026 is based on the ability of an ambulance to manage 4,416 calls annually. As the service approaches or exceeds 100% capacity, there will be an increased occurrence of code zeros and increased response times due to ambulances responding from adjacent communities. The far right column calculates estimated call volume capacity based on the former metric. This number was adjusted upwards in 2025 as the time on offload delays has declined and time spent per call has declined. The metric will worsen if offload delays increase again. If offload delays worsen to previous levels, the service would be beyond capacity in 2025. So this slide details the financial impacts of the 3 budget options requested by committee and the multi-year forecast for each option. Option 2 have adjustments made in some key areas. Cross-border billing is expected to increase under option 2 and 3 as code zeros will increase with a reduced number of ambulances in Brantford to respond to calls. Paramedic salaries, wages, and benefits includes savings of salaries, but has some offset by severance costs for reducing full-time staff, as well as increases to overtime and part-time earnings related to expected staff burnout and projected increase of sick time. Staffing-related costs is expected to increase under option 2 and 3 with an increase in meal claims related to reduced capacity in the system to allow staff breaks. And the federal provincial grants is reduced in future budget years due to the lower base operating budget in 2026 compared to option 1. I just wanted to take some time just to look at the headquarters lease, which is a significant driver of the budget in 2026. So this chart details the financial impact of the new lease costs based on current estimates. The financial impact of the new leases has the greatest impact on the municipal budgets in 2026, with provincial funding covering 7.4% of total lease costs next year for the new headquarters. The financial impact is mitigated in 2027 as 50% of the 2026 costs are applied, and the full provincial funding for the leases is incorporated in the budget forecast by 2028. So staff went back and looked at the lease funding as well, and I think something that wasn't highlighted at the last meeting is the contribution from development charges. In 2026, the County of Brant will fund $42,888 from DCs towards the headquarters lease. With this adjustment under option 1, the county's 2026 increase is 15.6%. It's currently not known what the city's eligible contribution would be in 2026. It would be based on the city's DC background study. Staff have also considered the qualitative impacts to potentially reducing service levels in 2026. So this would include an increased reliance on neighboring communities, which will impact performance to calls negatively. We expect staff recruitment and retention challenges, noting that the province currently has a shortage in paramedics, and it is currently already challenging to recruit staff to the service. Increasing staff burnout without meal and decompression breaks would lead to an increase in sick time and erosion of morale, and an overall increasing strain on an already overburdened healthcare system. So the recommendation from staff is to maintain option 1, noting that the major driver is the new headquarters lease in 2026. The lease reaches full provincial funding by 2028. This would preserve system capacity resources as growth continues. It would maintain and work to improve response time performance prioritize staff morale and well-being, and the budget forecast under this option does show beyond 2026, we would be at a sustainable level, 3.6, 1.3, and 1.5. And that concludes my presentation.
Okay, thank you, Cindy. And I do want to thank you and staff for putting those numbers together pretty quick for the different options. I know you did a lot of work for it, so I do want to express my appreciation for that. And thank you for the presentation. It was a good summation of what was in the report as written. So, any questions for Cindy on that report before we move on? Okay, go ahead. We'll start with Councillor Pierce.
Thanks, Mr. Chair, through you. So just a quick question. You spoke of, obviously if we reduce the number of ambulances, we reduce the number of paramedics. How does that, obviously there's severance in there like you stated and that sort of thing, but how do you determine which paramedics would have to be let go? Is it the like, do you say, hey, does anybody want to go, or is it the lowest on the totem pole, or how does that work? And would they just go to part-time, or could you elaborate on that end of things if you could, please?
Through you, Mr. Chair, we do have full-time and part-time paramedics. It would go by seniority as per their collective bargaining agreement.
Okay, and these would be, sorry, Mr. Chair, through you, and these would, if in fact we did choose to do this, this would be full-time staff that would need to be changed numbers, correct, FTEs?
Through you, Mr. Chair, that is correct. I'm just going to say if we had 80 full-time staff, we'd be decreasing them down to 76.
Okay. Okay, so thank you for that. And just a comment, if I could, Mr. Chair. I appreciate the fact, absolutely, of staff going back and giving us the different numbers for, for the different options and stuff like that. And it's true. I think if we look at the 16.6 this year, if we try and figure out, and I was trying to figure it out last night, I'm thinking it's around 5%-ish that it would, us having to pay the 100% of the lease this year is causing that extra 5%, if I'm figuring it out correctly, in this year's budget. Yes, we know this year is going to be up because we have a new lease, but the addition of the province not paying their part is exasperating this. And I think that's, if we kind of keep that in mind, the fact that if we want to call it a normal year, then we would not be at the 16.6 because the province would be paying their portion of it. So again, I'm a numbers guy, you know that, and I appreciate being able to look at all the numbers and then make a decision based on what we feel is best as that. So thank you for now.
Okay, we'll go to Councillor Martin. And bear in mind, we're not debating the budget per se. We're debating what is in this updated report, updated numbers.
Yep.
So just, and I'm not saying, Councillor Pierce, that you were doing that, but just a notice to all members. Okay, go ahead, Councillor Martin.
Thank you. The chart that shows the increases due to the new station, is it factored in there, the savings from the station that we're not going to be renting? Like we're going to reduce the number of stations, are we not?
Yeah, through the chair. So that chart is specifically related to the headquarters lease.
Yeah.
But the budget forecast does take into account removing the 2 Henry Street stations post 2026. So those leases both end at the end of next year.
Okay.
Yeah.
And how much do we have in reserves for new ambulances?
Through the chair, I'm not sure if our deputy treasurer heard that question. I would refer to her.
My apologies, through the chair. I actually missed the question. If you could repeat what the question was?
Yeah, how much do we have in reserves? I know we have a reserve for ambulances.
Sorry, through the chair, just 1 second. Let me open that spreadsheet. So currently available in reserves for vehicles and equipment at the start of 2026 is forecasted to be around $89,000.
Okay. Yeah, thank you.
Okay, there's actually a good chart in the report, which is at the end of this one, on the reserves, so just so you're aware. Okay, we'll go on screen and we'll go to Counselor Hunt first.
Thank you, and through you to Cindy. So we're currently operating with 8.5. And so correct me if I'm wrong, we wouldn't have to lay anybody off or terminate anybody, pay severance if we stayed with 8.5. Is that not a correct assumption? Because the initial budget has us going to 9, right?
Through the chair, that is correct. The option with 8.5 doesn't include staff termination costs, but there is some estimate for increased overtime and part-time coverage.
Okay.
Because the new ambulance is scheduled to go on October 1st, which we've put a pause on right now.
Okay. All right. Thanks for that.
Okay, no further questions from Counselor Hunt at the moment. We'll go to Mayor Davis next. And we'll get you off mute.
Yep. Is that good?
Perfect, yep.
Okay. Yeah, so as we look at this budget and the information we've been provided, and thank you staff for doing that, it's very helpful. First of all, in terms of the numbers, have I done it correctly? If we leave it at 8.5 ambulances and we compare that to what it would be at 9 for 2026, is the overall net impact on the city of Brantford levy about $108,000 if I look at the difference? Because at 8.5 that reduces the overall budget, and then I think about 42% of that reduction would apply to the city's net levy. Have I got that number right?
100 and,
I've got about 108,000 approximately.
yeah, I got 185,000, but that would be the correct number, right? Yeah. If instead of staying at 8.5, we went to 9, the city's levy would be 185,000
Less.
yeah.
Less. Okay, good. So my math was a little bit off. Okay. So the Chair, if we look, so the issue is demand, right? And predicting demand, and this budget, as it is every year, is an attempt to match supply to demand. So my question is, we know that offload times are improving, and that's a major impact on the service. As much as 40% of their monthly time can be spent there. What do we predict is going to happen through 2026? Do we expect that trend line, the positive trend line we've seen in the last 6 months with efforts of our fine staff and I guess the nurses that are being paid for by the province? Do we see that continuing? Do you see it perhaps improving to some degree?
Okay, we'll go to the chief for this one.
Through you, Mr. Chair, we actually met with the hospital yesterday, and what we see or what they forecast is the trend to remain constant. They said to us and requested that the next time we have a DOMP meeting, that they're requesting or going to ask for additional funding to keep up the need within the emergency department. Currently, right now, it is basically dealing with rates, staffing, but we had a meeting with the ER director yesterday, and they will be asking for additional funding to help maintain the offloads that they're currently experiencing. They could be having issues that they did not share with us. It could be just space. It could be call volume for themselves, but they will be asking for additional funds to help maintain what they currently have achieved to date.
Okay.
So I do not see an increase. I do not see a decrease. I see a straight line.
Okay, well, that's better than an increasing line that we've been seeing so frequently. In reference to the other major input or factor that we have some control over, obviously it's that new triaging medical priority dispatching system where the urgent cardiac arrest calls would be number one, and, you know, stomachache is lower down the list. So you said that Niagara's been doing this now as a pilot program for what, 2 years, 3 years?
Through you, Mr. Chair, they've had their pilot program, I believe, going almost 10 years.
Oh, 10 years, okay. So what's the data coming out of there? Have they done an analysis to say before the medical dispatching system, you can expect a X percentage reduction in calls, or is that data available from that pilot?
Through you, Mr. Chair, their system, their pilot system has basically morphed into other items. I would not count them as a clean representation on how it has improved. I would have to look more to the Peel region and the Mississauga region of Ontario to see if those improvements have been made. Niagara has invested a lot of funds into having nurses at the dispatch center, physio people on their ambulances for the trips and falls, all at an additional cost to the Niagara region. So they did start off with the original, we'll say, MPDS system, but they've invested a lot of funds into improve their offloads and other capabilities within their communities. Niagara would not be a good example. It would have to be more the Peel regions, because Peel and Barrie regions were, I believe, the first adapters in our area for the new MPDS system.
Yeah, is it true that in Niagara, what they're sometimes doing is paying for a taxi to take someone to the emergency department if they, you know, are of a lesser acuity?
Through you, Mr. Chair, I did speak to the chief regarding that, and he did send me back an email before, is the taxi is very sparingly used. When we spoke, and I believe this was brought up at another council meeting, it was only anywhere between 20 and 30 occurrences of frequent people doing so. People were using it, and I'll just give an example. The ambulance to get them downtown walks out of the back of the ambulance afterwards and proceeds on their way. So it was a successful program, but it's not as robust as you would read in a document.
So you mentioned Barrie and Peel. How long have they been using the medical priority dispatching system?
Through you, Mr. Chair, I believe Peel was one of the early adopters, starting, I believe, in 2023, 2024. They were late getting out of the gate because of COVID. I could probably get an exact date if you require.
Well, what I'm more interested in is so their experience with this system, which can be which could have a major impact on demand and how we manage demand. Surely, to goodness, they must have some quantified data where they can say to the rest of the province, you use this system, you can expect, you know, X in terms of your call volumes. Isn't that out there?
Through you, Mr. Chair, it is so new right now. It's taken us about 9 months to look at our call volume. Every service is unique. There's currently like 2,200 different dispatch priorities right now. I would be able to reach out to Peel and give you an overview as much data as they currently collected. If it has improved, it has stayed the same, or it had basically worsened. As people say, the new stuff coming out is always great. Looking at the data as you're suggesting, we'd be able to get that from them.
And a couple more questions. So does Niagara, do they actually send say a physiotherapist if the call comes in and they determine at the dispatch center, we send out a physiotherapist, that's better than taking that person to the hospital, or that'll provide better service. Is that what they actually do?
Through you, Mr. Chair, I do not have the details completely with me right now, but we're aware of different programs with the nurse being in the dispatch center. Niagara has their own dispatch center. Ours in Hamilton, located right beside Mohawk College, is a provincial dispatch center that controls Hamilton, Haldimand, Norfolk, ourselves. There's no nurse up there. They have different rapid response programs. Our community paramedics are similar, but we don't do a treat and release program currently in Brantford because we do not have the abilities for alternate destinations.
Okay, so we're tied into Hamilton through the dispatching center. I assume they've got the same problem we have or experiencing. What are they doing to incorporate that new dispatching system into what they do? And shouldn't we kind of try and mimic what they do?
Through you, Mr. Chair, I am unaware what they're currently doing as their projected future plans to combat the call volume and offload delays.
Shouldn't we be inquiring if they're a partner in our dispatching system?
Through you, Mr. Chair, the MPDS we're working as a service with them to implement the MPDS. Any improvements to the service regarding MPDS, we won't know until we actually physically launch, work through the different, we'll say, kinks in the system, and then make recommendations on how to better our overall services between ourselves and the CAC Center.
Okay. My last question to you is, in the graphs that you've given us, and again, thank you, very helpful, you've done a prediction, what will be the percentage capacity of our system if we have 8.5 or 8 or 9. But am I correct that when you did that, you assumed the same call volume? Like, you really haven't factored anything in for reduction medical priority dispatching. Your assumption is that it has zero impact.
Through you, Mr. Chair, I do not anticipate our call volume to decrease. It's the overall priorities of our call volume. Our anticipation is our call volume will still increase by 6%, but with the new MPDS system, the higher priority calls will take priority. The lower ones may wait hours, 12 hours, or whatever the case is, right? Hoping that the people would find alternate solutions. But I do not foresee with MPDS that our call volume will decrease.
Yeah, but don't you think over time, kind of the message circulates in the community, if you have a very low acuity issue, you're just best to go to the walk-in clinic or see your family doctor. Isn't that what happens with priority dispatching systems?
Through you, Mr. Chair, that is correct. But as are legislated, they can't refuse a call for service. No matter how low the acuity is of the call, our dispatch centers and the provincial centers cannot refuse service. The same thing as we go to a household, if it's a lower acuity call, currently at the time, and somebody has a cut finger, or I'm just saying something simple, I'm not trying to downplay somebody's pain at the time, we would still, if they request, still have to take them to hospital. We cannot refuse that service.
Well, it doesn't say when you have to go. It says you have to go. And that's the idea behind triaging, right?
Through you, Mr. Chair, that is correct. We are directed solely of all vehicle movement through our 911 dispatch center. If they feel that we have enough resources and it's a lower acuity call that's been only holding for 10 minutes, they'll send our vehicle. If it's been 12 hours and the person's still requesting service, they'll still send our vehicle.
So can I get a yes or no answer? So you, in your call volumes, you've assumed that medical priority dispatching will, over the course of time, have no impact on call volume. Yes or no?
Currently, I would not, without having more significant data, I would say the call volume increases will remain the same until we have an opportunity to evaluate the data, the calls coming in, and make recommendations like Niagara has in the past, right, to defer calls. We've started public campaigns through social media for people to defer calls. We would have to wait till we had the data to make those changes to improve what our call volume is right now.
Okay, thank you.
Okay, just a point of, just going to follow up on the one question of the mayor's, the 6% increase. I mean, that's not a number pulled out of the air. That's based on the increases on average over the last 10 years, 6%. Is that correct? Just to be clear.
Through the chair, yes, that's been the average.
And you have to use that number. We can't just assume nothing. So it's based on historical. Okay, any other questions on the 8? ambulances versus 8.5 versus the proposed 9 in this report. Okay, it's great information. So we got a mover and a seconder to receive this for information, which will come in handy for 4-2. So all in favor of receiving that report for information? Okay, and none opposed. That will take us to item 4.2. Now, Madam Clerk, we did have a mover and a seconder last week. Do we need one for this meeting?
This is a new report, so yes.
Okay. So I'm going to ask if we can get a mover and a seconder to get item 4.2 on the floor. Okay, moved by Councillor Hunt, second by Councillor Pierce. I'm going to open this up for questions only at this point. I don't want any comments. Are there any questions on the proposed budget that's before us for 2026? Okay, we're going to go to the mayor. Yeah, go ahead.
Sorry, I physically raised my hand. So my question, and I think I know the answer to this question, I just want to make absolutely sure. So what's on the floor is the budget with the 9 ambulances for next year.
Yes, that's correct.
All right, and so if we wanted something, or if we think that something different should be done, we would then move an amendment. And would it make sense if we do that to just simply say budget approved at 8.5? Or do you need something more detailed if someone were so inclined?
Yeah, at this point, Mayor Davis, if you want an amendment to the 8.5, we'd certainly entertain it after questions. So,
Okay. Well, the reason why I'm asking, Chair, is because I guess, aren't we actually approving dollar volumes that we then send up to the council? So I'm just wondering, how do you handle if the resolution is, let's say, 8.5, if someone wants to do that? Is that all that's required, or is it going to be a 2-step that you then have to give us a specific number or set of numbers to approve?
Yeah.
yeah, go ahead.
Through the chair, I think what we'd need to do is update what's in the recommendation under point 1, the base operating budget. And that number, I think we could get through our treasury staff fairly quickly. The capital budget, if there's no amendment, would remain the same. But I would also point out that there are 2 change requests within that recommendation as well.
Yep. Okay. Thanks.
Okay. Any other questions on the budget? Which is at 9. Any other questions? Okay, seeing none. I guess at this point, I'm going to ask if there's any comments about the budget or what we've heard in the previous report as it relates to this budget. Okay, go ahead, Councillor Pierce.
Thank you, Mr. Chair, through you. Yeah, like I say, I think having the extra numbers of the 8.5 and the 8, I think that really paints a full picture. But the picture that we don't know, and as Russ alluded to, is what this new system is going to do to other than prioritize calls at this point in time. So I think if you break it all down, and even if we went to the option 3, it's still 11.2% increase, right? And that's going right down to 8 ambulances. And then you take into the factor of still one of the biggest criteria or biggest players in this year, or like 2026, is the amount of the lease. So I think we really need to understand, are we making a decision, a rash decision potentially based on this year's budget? Because if you look at the next few years, they drop to what they're going to be going forward. Yes, it's a bigger increase this year. We know why, we understand why. Do we ride that wave and get back to, if you want to call it, normalcy in the next few years? It's to me, I'm struggling weighing that against if we were to, as I say, if we went option 3 down to 8, it's $583,000 savings. If we went to option 2, it's $256,000 savings. But we have to understand what the fallout is of those, right? And that's the tough part to grasp in here. So I'm looking forward to conversations from others here, but I'm struggling weighing the options here.
Okay, any other comments? Because I will certainly weigh in. When I heard the proposals to look at the eight and a half versus the 9, I thought that was an excellent idea. I will say I'm surprised on the downside, a little bit disappointed with the savings. And if I look at the county savings, 8.5 versus 9, the savings are $72,000. I was shocked. And it's not much more significant versus 8. And the issue is, that's just for this year. We know going forward, the province, which is supposed to pay up to 50%, we're going to actually lose some money in future years, but if we go down. So that's how I read it. And this is one of those services, and I think we all appreciate it, that we really don't have a choice. And that says it in our report too. If a call comes in for service, we have to provide that. So it's not like maybe a few of the other services that we as municipalities provide where we do have a little bit of flexibility. So, okay, I'll go to you, Mayor Davis. Do I tell him he's on mute or not?
You're on mute, Mayor Davis.
Tell me that, I'm not used to going to meetings virtually anymore, so. Couple of factors. And actually council last night, we had a presentation in respect to the food, like I said, crisis, but the food problem or difficulties that we have in our both communities. And how many people, well, especially those in Ontario Works, frankly, I don't know how they survive. But even those that say are working and earning, say, close to minimum wage, it's a real struggle to be able to make all ends meet. And like the demands for food services are ever increasing. And, you know, looking at some of the recent inflation statistics, we still have inflation in this country, and particularly in respect to groceries. And that's where the pinch is really being felt on the kitchen table by a lot of families in our community that, you know, they're having difficulty making ends meet. And many of them have homes, and they're own their homes, and they're paying property taxes, and it's a major part of their budgeting. And so I think we have to be mindful in all our decision making, especially this year, as it looks like we may be sliding into a recession, the impact of what Trump is wreaking upon us. And so I think this year, more than ever, we got to take a hard look at our budgets. And in respect to paramedics, you know, we know it's increased 90% since 2020, by far the way beyond any other service that we help fund or operate. And that's because it's an important service, and we are no question critically impacted by decisions that are made in Queen's Park regarding the healthcare system, and we're kind of picking up the slack. But I'd say this about a budget. A budget does two things. Obviously it sets how much money each municipality will pay into the system, but budgets and the decisions you make also incentivize the staff and those who are managing the system. And although we've made efforts to control demand, about the 10 to 15% of calls that we believe should probably be best dressed in a different fashion, frankly, I don't think we've done enough. And if you do a budget at 8.5, I think it strikes a reasonable balance. You're not reducing the service. I think the impact of that triage dispatching, I think that'll have some impact, and common sense tells you it will, probably within months, I suspect. I'm disappointed we don't know more about what's happened in other areas, but setting at 8.5, I think sends a message from the board that oversees paramedics that we want more done to control and manage this demand as best you can within the parameters of this system. And in the past, we've not really ever done that. We've always approved budgets that really mainly focus to a large degree on the supply side. Just add another ambulance. And I think given the current economic circumstances, I don't think that's the responsible thing to do fiscally. And I think this is the year to do it. And as I said, we're not cutting the service, we're simply maintaining it at its current level, expecting that there will be some improvements in respect to demand with the medical dispatching system.
Thank you, Mary Davis. Any other comments before we look for amendments and/or we vote on this recommendation? Okay, seeing none. I know we talked a lot about, obviously, the new dispatch system. The report talks about the paramedicine program, which there's attempts, obviously, alternate destinations. And I think these things are coming. I think they will improve the system. I just think they're not here yet. That's how I see it. And I look down the road because we're going to call for 9.5. We're going to call for 10. And I'm thinking that maybe some of these systems will prevent that. But that, again, that's down the road. We don't have the data for that just yet. So I'll look to the floor. Does anybody wish to bring forward an amendment at this time? Mayor Davis.
There, I unmuted before I talked. So sort of to focus the discussion and get it on the table, I would move an amendment to what's been presented to us, that the budget we present to our respective councils be based on 8.5 ambulances. Seeking a second.
Any questions or discussion on the amendment? And that's to stay 8.5, I guess. To use those numbers.
Sorry, we can't hear you.
I didn't have my mic on, that's why. Okay, so the amendment is to remain at 8.5 ambulances and to base the budget on that, and that would go towards respective councils. Is that a fair?
Yeah, seeking a secondary. If I don't get a secondary, then.
Oh, sorry, we did have a seconder in Councillor Martin, so.
Yeah, all right.
Yeah, my apologies, I didn't turn my mic on. So any questions on the proposed amendment? Any comments? Councillor Martin. And we'll go to Councillor Hunt next.
Yeah, I essentially what the amendment is to use option 3, which stays at 8.5 ambulances.
That's correct.
No, option 2 is 8. Option 3, the report I got. 2 goes to 8 ambulances, option 3 stays at 8.5.
Option
And the
3
amendment-
is,
Option 2 is 8 ambulances, option 3 is 8.5. You're correct.
Yeah, okay. I think with the triage dispatch, we're going to see a decrease in call volumes, and I think that staying at the 8.5 is reasonable. And because we're bringing in the lease expenses for the new headquarters and new garage, that's a huge hit to the budget in 1 year. By not increasing the number of ambulances, it allows us to defer that part of the cost into the next year when it's only going to be a 4.7% increase, and then even lower in the next 2 years, which helps make up for some of the big increases we've had in this department for the last number of years. Double-digit percentage increases, it's just not sustainable. It's not something that the taxpayers can absorb. So I think going with option 3 is a prudent thing to do. It is still a big increase for 26 of 14%, over 14%, but it's better than what was proposed by increasing the number of ambulances. So I'll definitely be supporting the amendment that's on the floor.
Okay, thank you. We'll go to Councillor Hunt next.
Thank you, and sorry, I can't hear Mayor Davis very well, so the only change to the recommendation is, and sorry, I'm flipping between screens here, but
Hi.
is
Good afternoon.
it's
I'm
just
on a
the
call
base
right now. Can I
operating
call you back?
budget. So
Councillor
we're
Hunt,
not
hold on one
changing-
second. Councillor Hunt, hold on one second. Oh, sorry, Marie Davis, we had to mute you from here, just so you know. Okay, Counselor Hunt, go ahead.
Sorry, so the amendment is only it's the base operating budget. So we're not changing the capital budget, and we are still putting forward the budget investments to be approved. Is that correct?
I believe so. I don't think we could change the capital budget. Is Counselor Hunt's summation correct?
Through the chair, we presented the capital budget last meeting. Certainly, it's within committee's direction to look at that and approve it. So if committee wants to look at that as well, we can.
So,
So I guess and again, I'm cognizant of the double-digit increases as well. And I hate to say what percentage are we looking at if we reduce the capital budget, and the two budget investment items that are on there, are they factored into the 14, which would be a 14.2%? Increase?
yeah, that's actually a good question. All right, so hold on, Counselor Hunt. So if we look at the following additional budget investments, item 1, expansion of First Watch, 79,000, purchase of 2 ER vehicles, 85,000. Is that included in these budget numbers? No, that's not included of the 12,462,000. We'd have to add that, correct?
Through the chair, no, the budget investments are not included in the base amount that's provided, the 12 point.
Okay, and so instead of the 16.6, we would have to add, 0.75 and 0.8, which is, 1.55, so. Good question, Counselor Hunt.
Okay, so I don't know if that requires a further amendment or a friendly amendment that we do not approve the forwarding of the two budget investments.
Okay, so what we do, we can vote on each item separately, when we get to those. Right now, we're looking at the base operating budget, and Mayor Davis, your amendment is that the base operating budget be based on an 8.5 number of ambulances, correct?
Correct. My thought was we would deal separately with those two other items. Hoping you can hear that, Councilor Hunt.
Okay.
I will have the clerk read back the amendment just to make sure we've captured it.
Thank you. And if I could just have staff confirm that my numbers are correct, but it would be that item I of the second clause be replaced with I base operating budget of 12,206.33, representing a 14.1 increase based off of 8.5 ambulances. Yes, correct.
Is it 14.1 or 14.2?
14.1.
It's 14.1 according to the report.
Heather Mifflin said 14.2. Okay, thank you.
Rounded up. Okay, they rounded up on me there. Okay, go ahead, Councilor Pierce.
Thanks, Mr. Chair, through you. So some of the comments that have been made here is we think that there'll be, with the new system that's coming in, there'll be a decrease in call volumes. Our chief has said several times that they do not expect a decrease in call volumes. He has said that today a couple times. He has said that in the past a couple times. So I'm leery to think that this system is going to decrease the number of calls. Like was said, if somebody calls 911, umpteen% of them shouldn't be. We know that. And we're not going to change that. As I said in the last meeting, that's something in my mind that needs to be driven from the province, and it's not being done. It's the easiest way. As the chief said earlier, sometimes they were using it for a ride downtown. That's how pathetic some people are to use this system. We're not going to get around that. So at the end of the day here, what we're looking at is a $256,000 savings in hopes that our call volumes either stay the same or go down, or we're gonna find ourselves in a situation where we're over the 100% again, and our paramedics, when you talk about them, we were in situations before where they were not able to take lunches, the morale was down and that sort of thing. I'm trying to weigh the balance of the $256,000 savings that this would be staying at the 8.5 to weigh on those other things. And unfortunately, I can't support that, because I think it's, we've got ourselves now where the chief has stated that, you know, they're able to take a lunch now. The morale is going up. I don't want to do anything to change that and send it the other direction. So at this point, I can't support the 8.5.
Okay, so appreciate the comments. We'll go to Councillor Hunt.
Yeah, so, and the reason that last week that I asked for the numbers at 8.5 is that we are not cutting service. That is the current service level, is the 8.5. And so potentially with the new dispatch system, even if the calls don't go down, they are, for lack of a better word, triaged on the phone versus taking them to the hospital and going through the hospital's triage system. And so I'm comfortable with the 8.5, and I realize from paramedic services, it's only a $253,000 difference, but I'm also cognizant of the fact that this paramedic service is only one of the boards that are coming at budget time, and so $250,000 here and $250,000 there, and you know, I know sitting on other boards that this is not the only board that's looking at significant increases. So I'm comfortable with the 8.5. First of all, for 2026, because after we get past 2026, the huge hit to the budget for the leases goes away. And we are not cutting service, and I think that's an important message. We're maintaining our current service level. So I guess those are the two, you know, driving factors for my initial decision to ask for the numbers that are the status quo, which is the 8.5, meaning we're maintaining our current service level while we absorb this huge hit to the budget because of the leases for 2026. Things I think are going to look a whole lot different for our budget and the ability to increase service for 2027, a year down the road. So those are my comments.
Okay, thank you, Councillor Hunt. I'm going to circle back to Russ, because Russ, there was some questions about the impact of the new dispatch system, and Russ, you do have some information on that. You said you could share.
Through you, Mr. Chair, as everybody was talking, I was listening intently. I pulled up a council report from Halton Region. The first statement had said, in December 2022, the Ministry of Health launched its MPDS triage tool at the Mississauga CAC Center. MPDS is designed to send the right resources to the right patient in the right way at the right time versus the traditional more is better approach, adding more ambulances, or faster is a better approach to paramedics response. The system prioritizes and improves response times for time-sensitive medical calls, which has the effect of prolonged response times and adding for lower acuity calls. Halton's experience in the first year of implementation of MPDS has shown some improvements in response times for their higher acuity calls, while response times for the lower acuity calls have increased significantly during that time period of high call volumes. There are two major factors contributing to the increased response times for lower acuity calls: performance from the dispatch center, as Mayor Davis referred to, and also handling staff challenges for overall paramedic services. I can share this. This is just their first experience within the first year of having MPDS. From what I read from this is they still have things to do, but it'll improve our response times for the higher acuity. The lower acuity will take a lot longer.
Okay, appreciate the update. Okay, we'll go to Mayor
Mr. Chair,
Davis.
I want to raise a point of order. I mean, I appreciate the information that she's provided, but once we are debating a resolution, it's inappropriate for staff to jump in and get involved in the debate unless a member of the committee asks them for information. I just want to point that out.
Okay.
We're debating a resolution. It's amongst the members of the board that we're part of overseeing this service, and I'm asking that we be mindful of those are the rules of procedure.
Yeah, fair enough. And the only reason I did allow Russ on that, because that question was asked earlier and you didn't have a fulsome response, so that's why I did that. Okay.
I agree it was helpful. Just I want to make sure that,
Yep.
it's.
Okay. In debating, we are, and again, we're on the item 4.2, item 1 for the base budget. We have an amendment, and we're going to do this line by line. So we'll talk about the capital budget after that, and then we'll go to the budget investments after that. But right now, the amendment is to base it on the 8.5, as the clerk read out. I'm going to ask, are there any other questions or comments on that? Okay, we'll go to Councillor Martin for the second time on this one.
Yeah, I think the information that we just received is very important. What we're going to be doing is increasing our level of service to the people that really need an ambulance and decreasing the level of service from ones that really should be going to a walk-in clinic or seeing their family doctor. And I got no problem with that. The ambulance service is an expensive service, and if somebody's got a cough, you shouldn't be calling an ambulance. And if you have to wait 4 hours, maybe it'll change their mind and they'll realize, well, I would have been seen at a walk-in clinic by now if I'd gone there instead. And that's going to drive down call volumes, hopefully. And even if it doesn't, we're improving the service to the people who really need it, and that's what I think is important here. So I think we can stay at the 8.5 ambulances without any problems that way, because like when I was working in Toronto, we ran a call. A woman said she was dying. I said, "What are you dying of?" She said, "I've had the hiccups for the last hour." So obviously they didn't need firefighters there, and the paramedic was right behind me. He heard it, and he said, "Well, you guys can go," because that was obviously, she wasn't dying. She was just wanting to cure her hiccups, and I don't know what she thought the ambulance was going to do or the hospital was going to do. But that's a call that could have waited a day. The symptoms would have gone away long before ambulances got there if it was triaged properly. Unfortunately, some people will lie to dispatch and give symptoms that they don't have just to make it sound like they're critical and need an ambulance right away. But that's something that we'll have to flag and find some way to improve on that. I was even prepared to go down to 8 ambulances, but I don't think that would fly with this committee. But I certainly support the 8.5. And we have to keep in mind that with the new dispatch system, that's an increase in level of service for people who really need it.
Thank you, Councilor Martin. Any other comments or questions before we call the vote on the amendment? Okay, seeing none. And I appreciate what you say, Mayor Davis and Councillor Hunt, as far as we're seeing those huge increases. It's a big impact. My big disappointment, and I've said this already, is it wasn't that much for the county. The city was an extra 185,000. I guess we'll have to make up our own mind. Is that worth the extra half ambulance or not? And so, if I don't see any other hands raised, I will call the question on the amendment. So, all in favor of the amendment? Okay. All opposed? So that's lost on a tie vote, but given that that's lost, we'd still have to vote on the original. Okay. This will bring us back, unless I see another hand up for an amendment. I don't see any. Okay, so we will go back to the original recommendation, and that is the base operating budget of $12,462,834. And that was moved? It was, okay. Any further comments, questions? Okay, seeing none. All in favor of the original recommendation? We're just doing the first one, the base operating budget. So we will go through line by line. So all in favor of the base operating budget as presented? All opposed? Okay, and that motion is lost. Now, on that note, would it make sense to continue with the other items?
Through the chair, what was the question?
Okay, so the base operating budget, the recommendation of 12.46 million is lost on a tie vote. Does it make sense to go into the capital budget and the additional budget investments?
Through the chair, I would say no. The capital budget is based on the operating budget through the transfer to reserve.
Okay. Go ahead, Mayor Davis.
Question to staff. We have an agreement in place to deal or address this very situation, which is split vote, because the committee has an equal number of members, and just that's a design flaw. But what does the agreement provide in the event that this committee can't reach at least a majority decision on the budget?
And we did talk about this earlier, Mayor Davis. Cindy, do you want to take a stab at that?
Yeah, through the chair. So we do have until the end of the month to submit the budget. So there could be potentially an opportunity to come back and schedule another meeting. Staff are just looking at the agreement now. So if you could maybe just give me a pause here. We're looking through the next steps.
Okay, so if we take a 5-minute recess, do you think you could have an answer by then?
Yes.
Okay, so it's 12:08, so we will reconvene at, and fingers crossed everyone can reconvene at 12:15. Okay?
Can I raise one more?
Yeah, go ahead.
I want to consider during the 5-minute break. And that is, I think you're going to find the agreement says if we can't reach a consensus or at least a majority vote, then the budget from last year, I believe, it becomes the default. If you could please check that. And if that's the case, would you also make a decision, Mr. Chair, if you would allow a revote of the resolutions?
Okay, fair enough. Just everything you just said, I had brought up earlier. Do we use last year's budget as a base for this year? We do have the county city liaison committee. We may have to go to that, but let's give staff 5 minutes. And
We found it.
or do we need 5 minutes?
We found it.
Okay, we will not take a recess because staff, in the time we were talking, managed to come up with the information we need. Go ahead, Cindy.
Mayor Davis is correct. Should the committee fail to provide a recommended draft budget on or before October 1st, the prior year's approved budget shall be deemed to be the draft budget. Any amendment of the draft budget pursuant to this article shall, upon approval by a committee, be deemed to thereafter be the draft budget.
So, can you put that into words that everybody could understand?
Yeah, so should committee fail to provide a recommended draft budget to city council, county council by October 1st, the prior year's approved budget will be deemed to be the draft budget.
Okay. But that's going to have implications for a few things, obviously. And I don't know, obviously, and I don't know if anyone here knows what all the implications of that would be. Mary Davis, you still have your hand up? Is that from a prior? Okay, go ahead.
Can we still take a 5-minute break?
What's that?
Can we still take a 5-minute break to consider all our options?
Okay, we're at 12:11. Okay. All right, 12:11. Okay, let's take a 9-minute break. We'll reconvene at 12:20. And we'll get Gary to shut us off till then. Okay, so we'll see everybody back in 9 minutes. Okay, we're back in session. I appreciate everybody's indulgence on this. Mayor Davis, you have your hand up. Did you want to
So I
speak
just
first
have
or?
a quick question.
Yep.
Can staff give me what that capital figure is that would be allocated to the city? Because I'm going back and forth with our treasurer, trying to find out what DCs might be available. I forgot what that number is.
So the capital budget of 1,286,000, you're wondering how much of that is the city's?
Yeah, because your staff gave us the county number and how much would come from DCs on that, right? There was a graph, remember there was a graph in the presentation? So I'm just trying to get the capital number that would be allocated to the city that development charges might be used for, and then I might be able to get the number from staff, what the development charge number.
Through the chair, I don't know if we fully heard that, but the city's capital budget is, portion is funded through that transfer to reserve in the operating budget. So it's really reflected in the 2026 operating budget. I believe the increase for 2026 was around 42,500 to fund that overall capital program in 2026. Unfortunately, we don't currently have the city's information with respect to development charges that could fund a portion of the lease.
Okay, so you're using development charges to fund part of the leasing costs as a qualifying capital expense for development charges.
Through the chair, yes, through the DC background study, the city, if it's in each individual municipality's background study, we are able to fund the cost, the bottom line cost of the lease from the DCs, dependent on each individual's background study.
And so Heather, you're then using that to reduce the operating budget impact for the county.
Through the chair, correct. I have spoken to the city treasurer before last year, but I haven't confirmed this year on whether you have that ability or not.
Okay. Okay, thanks.
Yeah, and that knocked it down for the county from 17.1% to 15.6%, which is not an insignificant percentage drop. Okay, so right now we have we had an amendment. It was lost on a tie vote, so that took us to the original motion, and that also lost on a tie vote. So if there's no budget passed, again, as per the agreement with the city between city and county, we go back to 2025 for the base budget for 2026, and that's what it says. The problem is, in reality, there's a lot of issues, and we were just running through some of them and some of the implications of that. And it is what it is, but our lease agreements with Grandbridge is now in jeopardy because of the work that's gone on. The offsetting funding from the province would also be delayed a year, so that hit would still come. It would just be delayed a year. There's collective agreements, which were covered off, obviously, for the end of this year till 2025. Those will be problematic, to say the least. We haven't accounted for inflation costs. Just looking at fuel alone, we know what's going to happen is we will run a deficit. Those costs will come in whether we have a budget or not. If we have the budget from a year earlier. And it's also going to impact transfers to reserves for the capital budget, which, as everybody knows, we use those reserves to purchase new ambulances, to purchase equipment, capital items. So there are quite a few implications of going back to that. Having said that, I will see if anybody from the committee has any comments on any of that. Go ahead, Councillor Martin.
Has there any thought been given to phasing in the lease payments to Grandbridge? Like ask them that we reduce our lease payments in 26 and 27 and then catch it up in 28? Just because of the way the provincial funding comes in?
Could we phase them in is the question. And I don't know, Cindy, if you have any insight onto that question.
Through the chair, right now, I think the way that the lease payments are in the budget are somewhat phased in. The Phase 1 portion of the headquarters started August 1st of this year. And we'll get some provincial funding for that in 2026. And Phase 2 lease doesn't start until August the 1st of 2026, and that's how that has been budgeted. Through the lease agreements, they are tied to end of construction dates. So, if we were looking at potentially maybe postponing use of the garage space, that would take additional negotiations with Grandbridge.
Okay.
Martin, does that answer your question?
Yeah, that's, like even, if they'd be willing to defer, 200,000 in 26 and 27, and then we make it up in 28 with interest, that might be of interest to them. We can still have the same occupancy dates, but defer some of the lease costs for a couple of years. Even paying the interest would make it more reasonable. I don't know if Grandbridge would be open to something like that or not.
Can we leave that as direction to staff to investigate that? Because I think that's worth looking at for sure. Okay, appreciate it.
Yeah, because, I mean, that's the big hit this year is the leasing costs and not, having to wait for the province.
Yeah.
Whereas if we can defer some of that, we lose the province's increase on that as well, but it pushes it to the year where it's only a 1% increase. We can certainly afford a bigger increase than 1%, but it's the hit this year, like coming up in 26, that's the problem.
Okay. Again, staff would have to do a little homework on that, but I think if we leave that as direction of staff, I think it's an excellent idea, and if they can, we're going to see that in front of us. Okay, so, all right, go ahead, Mayor Davis, before I go on my soliloquy.
Okay, so maybe you're going to tell us in your soliloquy, but what is your ruling going to be if its motions are put back on the floor, which in essence would be a reconsideration unless it's something different?
Yeah.
Maybe that's what Councillor Martin is doing for us, is if staff can give us a slightly revised budget with option 3, option 1, gives us technically something different to vote on.
Okay, so, yeah, I can't just put the motion back on the floor because then it looks like you're putting a motion on the floor until you get the vote you want. And that's not democratic as well. But we can reconsider under certain circumstances. We do have allowances for that, and that requires a 2/3 majority. So, and you can do that especially in light of, say, new information. So, for example, the implications that we talked about with it's going to create a whole caveat, a can of worms, I'll say. But it is what it is if you revert back to the original budget. As well, we may have some wiggle room on deferring that $200,000. Again, staff would look into that. and apply it to the budget right away, or we would apply it to the 2026 budget, let's put it that way. So before I call a reconsideration vote, I will go to Mayor Davis, who has two hands up.
Yeah, one last request. If we do kind of take a deferral to recalculate, asking county staff, can you really could you contact our treasury staff about this capital cost and the development charges? I've been trying to get that information, but they need some numbers from your treasury department to be able to tell the city members of this committee, what portion of the capital costs and potentially the operating budget will be reduced through use of development charges to pay for the leasehold improvements.
Okay, and my question to you, Mayor Davis, did you want that before we revisited this, or are you okay with getting
Yeah, I
that
mean,
information?
I think it makes it, I'm not sure it's going to make a difference, but it's obviously a relevant factor, as is Councillor Martin's request for, can we defer some of the leasing payments into the next year, 2027, when we know the budget pressures aren't as severe.
Okay. So my question maybe to Heather and Cindy is, could we get this information? Today is the 17th of September. We need to pass a budget prior to October 1st. And there's information there we would like to get, and I look to Councillor Martin, if he would, is that information that he would like to see before we talk about reconsideration?
Well, unless there's a reason to reconsider it, I think we need more information on other things we can do to reduce the big hit for 26.
Okay. Go ahead, Councillor Pierce.
Thanks, Mr. Chair. And, I appreciate the looking into anything we can do to reduce it. I get that. That makes sense. That's the right thing to do. But if we're talking about prolonging expenses that we have and then occurring interest charges to that, prolonging those expenses, that's putting us potentially even closer to a net zero difference. That's what I'm trying to understand here. So hypothetically, let's say we can push off some lease payments to the next year. Let's say, again, just throw out numbers. Let's say we can push off $100,000, but they're going to charge us interest on that. So not only do we still have to pay that $100,000 the next year, but we also have to pay interest on it. And when we balance that back to the amount of difference we're talking between 9 and 8.5 ambulances, it just doesn't wash. It almost nets out. So I'm all for anything we can do to reduce the budget. It's absolutely, and Councillor Hunt alluded to it earlier, there's many different boards bringing many different budgets, and they're large budgets across the board this year. I get that. I appreciate that. But again, it's the sum of all totals, right? When you're talking across the board. But for this particular one, what we're talking about doing here is potentially putting off payments that we're going to have to pay interest on. So in the end, is it worth putting off the payment compared to the amount of money that it's going to save us? So I'm not opposed to looking into it, but I think we really need to balance that out.
And you're right, maybe at the end of the day, if we delayed it, that delays the province. I don't know. That's why staff would look into it, I guess. I suspect you're right, so. I'm going to look to the committee. Do we want another session where we have a bit more information on the table? Thoughts? Do we want another meeting and try and schedule one before October 1st? I'll acquiesce to the, because I don't want to put it on the table and then find out somebody still wants more information. Mayor Davis.
I would strongly be in favor of doing that. I mean, I think we can all agree we don't want last year's budget to prevail. And maybe the information that Councillor Martin's asked for, it may be irrelevant in the long run, but it certainly has an impact for this year, which is, the meeting next year. And also for me, I'd like to really know from our treasury staff here at the city, just exactly what development charges will do in helping us deal with this budget. You county members, you've got the benefit of that information. We don't. I know that I'm going back and forth right now with treasury staff. They just need some information from the county treasury, but I'm sure they could get the information to the city members and county members as well. I would hope within, a day or two, probably less than that.
Okay. I'm not hearing from anybody else, so the direction then is what we'll do is we'll ask our staff to get those numbers, put them together in a report. We will reconvene, and I'll leave that up to the clerks because it may not be on a Wednesday at 11. We might have to show a little bit of flexibility. And then we will, once we get that report from staff, we'll have the meeting set up and we'll consider reconsideration at that meeting. Yes, Councillor Pierce.
Thanks, Mr. Chair. So it's twofold, right? The one was getting the information on potential deferred payments, and the other was
Development charges.
Our treasury talking to the city treasury to understand what DC payments can do in there. Yeah.
Yep. Okay. Do I have any other comments or questions before I adjourn today? Okay.
Do we want to try and set up a date one while everybody's essentially in the room instead of doing email after email, trying to find a date and time that works?
Well, we leave it up to the clerks because they know your schedule. They talk to your clerks know your schedule, our clerk knows our schedule, and that usually works best out that way, so.
Okay.
I'm just gonna look to staff. Are you clear on what we're asking?
Yes.
Okay. I don't think it's gonna take too long to get that information.
Yeah, I think I'm confident we'll be able to get the information through city finance. And I should have some indication from Grandbridge if they're willing to entertain that. It wouldn't be time to have any kind of signed amending a lease agreement with them, but we would have some indication on if they're willing to do that.
Okay. Two things we need from that report is Grandbridge willing to entertain that, but the second one is also the numbers. Does it make sense, given that, our funding from the province would also be delayed a year, and there would be interest charges on that. So, maybe we could put a little bit of a table together for
Yep.
doing it versus not doing it. And that's what I heard from committee, so. Okay, I appreciate everybody's indulgence on this. It's not an easy budget, and I understand that, but we are doing what we can within the framework we are allowed to do it in. So on that note, we're going to leave it to the clerk to figure out when we can meet next. And we have to meet again before the end of this month so we can have a budget to present prior to October 1st. So on that note,